Hi Port Macquarie, my name's Lindy Price. I'm really sorry I can't be with you guys tonight, and I just wanted to share with you a little bit about what I'm doing at NAREC and my experience. So I graduated from Melbourne University in 1995 and have worked in many locations, but a lot of time spent in rural and outback Australia, Broome, Alice Springs and Katherine, and have been in Newcastle for 10 years and working with NAREC for nearly a year. And just wanted to share with you about how stem cell therapy and physiotherapy can be used within your practice. Stem cells have lots of application, and there's a growing field of research into stem cell therapy. At the moment, we're using stem cells in the veterinary application for osteoarthritis. They are directed directly into the joint, so need to be done under general anaesthetic. And once inside the joint, they have a global anti-inflammatory effect, so that all of the inflammatory mediators released by damaged chondrocytes, including your COX-2, prostaglandins, a bunch of the interleukins and so on, are down-regulated. And there is also the opportunity for stem cells to work in a regenerative fashion, so there can be some resurfacing of cartilage joints. They also release a lot of cellular mediators to encourage the stem cells that are present within the joint to activate and produce new cartilage matrix, bone tissue, muscle, tendon, depending on where the stem cells are injected. At the moment, I've been using stem cells predominantly intra-articularly and have had some lovely results. Stem cells can be used for chronic cases of arthritis, and I have a case, a lovely dog called Casey, who is a 12-year-old female spay border collie, and she'd had chronic arthritis in her left forelimb for many years, and she was presented for evaluation for stem cell therapy. Unfortunately, at that time, we found a soft tissue sarcoma on her right side, so she was roughly 3 to 4 out of 5 lame on her left side. The client elected to go ahead with stem cell therapy at that time and then pursue surgical management of her soft tissue sarcoma at the carpus of the right foreleg. Unfortunately, the surgery didn't go well, and she ended up having a 4-quarter amputation. But the stem cell therapy in her left foreleg enabled her to have a good quality of life for the next 7 or 8 months before she had signs of metastatic disease and was unfortunately put to sleep. I spoke to her owner, and Rebecca said that she would do it time and time again because of the exquisite pain management that the stem cells were able to offer Casey, and how for the 6 months that she had, she was virtually pain-free in that side.
Look at the leg. Sit. Sit down, darling. Okay.
Freckles is another case that we've recently treated. Freckles is a 5-year-old Jack Russell Terrier who had a chronic luxating patella and went on to do her cruciate, as so many of these little guys do. We repaired her cruciate with a lateral suture and deepened her groove with a recession wedge, and we injected stem cells as we were closing at the time of surgery. And I have some video footage here of Freckles at her 4-week check. She had physiotherapy after her surgery, but examination of her knee, she's doing really, really well. There's very little inflammation at the site of the surgery, and she's a much happier little dog using her leg pretty much all the time now.
Water.
I'm excited about the opportunities that we have to combine both physiotherapy and stem cell therapy with orthopaedic procedures. And physiotherapy, when I started using it 4 years ago, some of the techniques there, the results were quite astounding in terms of return to function, getting these dogs back on their feet faster, reducing the muscle loss that you see so often when you've got a chronic injury. And muscle mass, once it's lost, takes a long time to recover, same as bone mass and so on. And in effect, basically, physiotherapy post-operatively makes me look like a good surgeon, so why wouldn't we all want to use it? There are a number of different ways that we can apply simple physiotherapy techniques and education for our clients to improve the outcomes for our patients. And I would be more than happy to come out to your clinic and do an in-service for the day and train nurses and staff and as to how to appropriately apply protocols for different post-operative care and improve your patient outcomes as well. I'm also available to consult over the phone or provide advice for physiotherapy cases. And of course, if you have cases that are prepared to travel down to Newcastle, we'd be more than happy to see them here as well.